KCL in Bristol. You're probably thinking, what am I doing here? But I got my dent offer from Plymouth. So yeah, Hamza.
Yeah, guys, my name is Hamza. I'm a BDS1 dental student at University of Plymouth, and yeah, let's crack on. So I think I'll do this slide. So why Plymouth? As you can see, we've got four things on the screen here, and we'll talk about each one in more detail. So one of the standout features of the program is the early patient contact starting in year one. And from the first week, we develop skills in the simulated dental learning environment, which allows us to practice safely using phantom heads. And this really helps us build that confidence, that communication, and teamwork skills early on. And just talking about the course itself, Plymouth uses a spiral curriculum, which means you revisit topics as you go along the course. And this approach gives you a solid foundation, allowing you to reach a better kind of knowledge when you're in them more higher years. The second point is the interprofessional engagement. And this is a key part of the course here at Peninsula Dental School. And through this interprofessional engagement, we get to work closely with local and disadvantaged communities, as well as other healthcare professionals such as pharmacists and nurses. This will help you to develop that professionalism which is needed in dentistry, but also gives you that social accountability and a real understanding of what population needs in this local area. The third point is societies and student life. So when it comes to societies, Plymouth offers a huge range of societies to choose from academic ones like biology or to sporty ones, kind of like surfing. And regarding the student population, it's a very diverse population with a strong student hub that prioritizes student safety. I think it's much more easier to maintain that healthy work-life balance in Plymouth, as being close to places like Smeaton's Tower or Dartmoor National Park or even the coast, it gives a lot of time and opportunities for you to just switch off outside of dentistry completely. And last but not least is the multi-site clinical placements, which essentially in clinical training, it takes place across multiple facilities here at Peninsula. In year one and year five, you're situated at the hospital in Plymouth, which is called Derriford Hospital. In year two, you're still based in Plymouth, but you're at a different facility called Devonport. However, in year three, this is where it gets a bit different, and you'll take a coach, all 100 students on a coach, and you'll go to Exeter. This can be, I think, 3 times a week, and there is where you will treat patients. However, in year four, you will move to a different location. You will move to somewhere called Truro, and that's not far from Plymouth, but you will be residing in Truro and treating patients there. And then, like I said, in year five, you'll come back to here. And this exposure to different clinical settings and that patient journey really does prepare our students well for real world dentistry. And I think this is one of the best things about dentistry here at Peninsula is that number one, this early clinical exposure coupled with this multi-site clinical placements will make you a really safe and very practical clinical dentist when you graduate.
Amazing. Thank you very much. So now we are going to go through a little bit about the interview format. So you guys probably know this first bit because it was sent out in the emails, but it's an online MMI format with 5 stations, and there should be 9 questions assessed by 4 different interviewers, and the whole thing will take you about 55 minutes to an hour. And each question, it evaluates 3 attributes and they're scored up to 5 points each. So your maximum score is 135 because you've got 9 questions, 3 attributes, 5 points. And what they claim to be assessing is whether the candidates demonstrate the personal qualities needed. And they have a very big emphasis on communication, decision making, understanding the impact of illness, reflection, motivation, integrity, resilience, adaptability, and teamwork. And obviously, all of this aligns with the NHS values. So, solely based on that, you can kind of guess what most of the stations will be similar to. And before the interview, you guys will also receive instructions for a manual dexterity task. And this takes up one entire MMI station. And each section of the interview also includes a red flag section, and it's marked yes or no. So it just flags behavior or comments that they see as unacceptable for the program. So, say if you say something problematic, then you will get red flagged. And no matter what you ended up scoring on the interview, even if you got full marks, it's basically an automatic rejection. So, some specific advice based on that is obviously due to the red flag system, you need to make sure your language is professional throughout the whole thing and ensure that all of your arguments are balanced. So, say for example, for opinion questions, rather than kind of doing all the pros, then all the cons, and accidentally coming off too strong on one side, if you alternate between the pros and cons, it makes your argument more balanced and you'll be better equipped to give a nice, solidified conclusion. And then for the manual dexterity task, I would genuinely just recommend learn how to do it till it's muscle memory because remember, this is still a whole MMI station and they're not going to sit there for 5 minutes just watching you make something. So they could definitely still speak to you during this time. So things to think about are, why are you doing this task? What skills are you using? Why are these skills important? So have a think about that sort of stuff while you're preparing for the manual dexterity station. And yeah, so another thing is when you're doing the task, you need to also make sure you don't get distracted. That's why I'm making sure that you guys hopefully know how to do it from muscle memory. So no matter what, even if they do throw at you like a diabolical question, if your hands like you know what you're doing, then you should genuinely be fine. Personally, I thought it was quite relaxing.
Yeah, so we'll move on to life at Plymouth. So for me, life at Plymouth has been a big part of my experience so far. Moving 6 hours away from home was a huge step for me, and at the start, it was definitely unfamiliar and a bit overwhelming. But Plymouth is one of those places that grows on you very quickly. The people here are genuinely friendly and welcoming. And I remember once I actually got lost on my way to uni, and instead of just pointing out where to go, they actually offered to take me there. And it just shows the kind of community Plymouth has. But in terms of being a dental student here, I'd say first year is really well balanced. I wouldn't say it's chill, quote unquote, compared to other universities because we do have quite a lot going on. But it's structured in a way that makes it enjoyable rather than overwhelming. So, going through a week at Peninsula in year one, we have around 6 hours of phantom head training, about 4 hours of lectures, and usually a workshop weekly. And what I really like about this is that balance between theory and practice. You're not just sitting in a lecture all day, you're actually putting in that effort and getting that hands-on experience using drills and working on them phantom heads. And applying what you've learned, it's actually exciting. Like you're finally doing dentistry after all that time just reading about it. But as you can see, I put four pictures here on the slide, and we'll talk about them very soon. So outside of academics, the social side of Plymouth is also amazing. So I'm myself part of DentSoc, which is a dental society here, and it's honestly been one of the highlights of my experience. Every month, there's a full calendar of events, and there's always something to look forward to. So in our first month alone, we had bowling, a meet and greet at the boathouse near the sea. We had quiz night, pumpkin carving, and that's just a few examples. And it makes it really easy to make friends, especially when you're new to the city and don't know many people. And then is the city itself. Look at these stunning pictures. You won't believe it, but this is Plymouth in summer. So on the top left, you have Smeaton's Tower. On the Hoe, you can go for walks and sunsets. On the right, you have the Royal William Yard and the Barbican, which is good for food, coffee, and socializing. In the summer, you can even take a small ferry to an island called Drake's Island, which is the beautiful island on the bottom left. And that's perfect for walks and views. And if you're someone who actually enjoys hiking outdoors, you've got the Dartmoor National Park, which is not too far away from Plymouth, just for a bit of fresh air. And being by the sea really helps with switching off, especially with the intensive course such as dentistry. And it's easy to see why Plymouth is known as Britain's ocean. Oh, sorry about that. It's easy to see why Plymouth is known as Britain's ocean city. And at the end of the day, I think it's a really nice place to be a student. You're learning dentistry, but you're also enjoying your time at uni. And I think that's what makes a big difference to your experience, and especially mine here.
Amazing. That was great. So next, we've got some practice questions, but before that, I'm just going to quickly answer some of the questions in the chat. So, yes, this meeting is being recorded, and all of the webinar sessions are posted on the YouTube channel. What sort of manual dexterity tasks can there be? Obviously, I can't say which uni and stuff like that, but some examples of manual dexterity tasks in the past could be maybe making like shapes out of pasta, like animals or something like that, maybe doing origami. So anything that kind of relies on you being able to use your hands and have that hand-eye coordination. And when will you be told about what your manual dexterity task is? Okay, so I got the email about mine, honestly, I think about 2 days before my interview. So you don't really get that long, but yeah, I feel like that's enough. And where did it say there was a manual dexterity task? They only tell you kind of last minute, so don't worry if none of you have got that email about it yet. But yeah, we'll move on to practice questions now. So this is the first one, and we've got two. Obviously, multiple people can give it a go, and you're going to get feedback off us as well. So we'll give you guys like a minute of thinking time, but can we please have some volunteers as well? So use the raise hand function in on Zoom if you'd like to answer this. Have we got no volunteers? Does nobody want to answer the question? Okay, we'll give you guys like a minute of thinking time to think of ideas and then, okay, that's fine. Great stuff. Okay, we've got two volunteers, so both of you can give it a go, but have a think first and then genuinely just unmute and start speaking when you're ready.
Hi.
Hi.
So I think in this situation, it's definitely important that as a student that you should tell the patient what's gone wrong. Under the duty of candor, it's in your best interest to tell the patient if you've done something that can harm them or have the possibility to harm them, you need to tell the patient. Just because it's a fellow student that's done it, you would probably want to take that fellow student aside and let them maybe do it themselves and encourage them to kind of have that good behavior in themselves. But if they said that they wouldn't do it, you would have to probably do it yourself to ensure patient safety. You, if you were the student, you'd probably go about it by explaining what went wrong potentially, and then definitely apologizing to the patient and explaining what you've done means. So, like any new risks that have come up in their care potentially, and also you'd want to ensure that you maybe tell a superior about it because they may be able to give you advice on what to do or um, kind of how to reflect on it and ensure that you don't do that in the future.
Amazing. Thank you very much. So that was a really good answer. Few things that I'd also add are for anything like this where somebody makes a mistake, even though you're only a student in this situation, you'd want to make sure that it's documented properly. So that would come under obviously informing a senior and escalating it if they weren't going to escalate it themselves. Because ideally, you want the person who made the mistake to escalate it and confess, but if not, you need to do it to make sure that it gets documented and you want to explain why as well. So, in this situation, the first thing we're always thinking about is patient safety and well-being. And another thing I'd add is when you speak to the student, you want it to be obviously discreet and calm and maybe one-to-one in a private environment. So it's not in front of the patient because that could be a distrust in the profession issue. But that was a really good answer. Hamza, do you have anything to add?
I think that was a brilliant answer, like you said. Regarding a couple of things you can do extra maybe is to write it down in your personal development plan. So this is some sort of document, even we get it in dental school, where you get to write reflective exercises on anything that you have encountered. And this can maybe go into that journal just to reflect on it. And maybe you can also do CPD as a student. So CPD on professionalism or how to raise concerns in practice because I think this is a very important scenario and this can happen in real life. And the way you react is essentially your professionalism. So I like the way you said duty of candor. That's a big thing that I look at interviews is that professionalism that you have. So yeah, brilliant answer.
Amazing. Who would like to give this one a go next?
I don't mind.
Amazing, thank you. Feel free to start when you're ready.
Oh, is this the same question or a different one?
Yeah,
Oh,
same
okay.
one.
Okay. So first off, I believe it's important to understand what the ethical dilemma is. And I believe that looking at the four pillars, the most relevant one here is non-maleficence, as this mistake that was made by the fellow student could have caused possible harm and put patient safety at risk. So it's important to first off to address this with the student in a private manner, make sure that it's non-confrontational, and just not to jump into any conclusions, as this may be a mistake that the student has made and is not aware. So by being able to just in a non-confrontational manner, just speak to the student, understand what they have done, and hearing their thought process. You can do a couple of things depending on their reaction. If their reaction is something where they didn't realize they made a mistake and they'll act upon it, they'll reflect on it, and they'll document and reflect on this, that's great. However, there are situations where the student might be dismissive, might throw this upon. So it's important that once you've potentially urged the student to document and report this themselves, and they still refuse, it's important that you do it yourself to, for example, I'm not sure, but like a clinical lead, whoever is in charge. And from then on, is very important that you document and reflect on the situation of how did it come to the situation where a mistake was made? Was it because of reasons like laziness, tiredness within the student? What's going on through the student's life? So it's important to be empathetic with the student as well. So yeah, that's how I'd answer it.
Amazing, thank you. I really liked in your answer you started with ethics and kind of delve deeper into them, and then you also talked about being non-judgmental towards the student because that's quite important too. As in a real life scenario, you probably know the student personally, so the interviewers know that you're not going to suddenly just go and report people like that, and you shouldn't anyway. But something small that I'd also add to that is maybe delve a little bit deeper when you talk about the skills needed. So when you obviously you acknowledge that this is wrong, but maybe talk about why. And you can say that in dentistry it requires honesty, accountability, transparency, and those kind of soft skills as well. Hamza, do you have anything to add?
Pretty much what you said. However, at the end, I also suggest signposting the student to someone more senior for advice, or if they are struggling, then you can kind of signpost them to student services or people like that. I think if you added that bit at the end, it'd make that answer really good.
Yeah, absolutely. Because any question like this, where anybody's struggling or, anyone's facing any sort of personal issue, always make sure that you offer your own support, but then signpost them to some other external services. So this could be like university wellbeing services, external services, because then it shows that you're not so convinced that you can sort everything out yourself and that you're able to delegate tasks and direct people onto like help when they need it. So that's a good skill to show as well. We'll move on to the next question now. So actually, this is the mark scheme for that question. So I'll go through some kind of interesting bullet points that you guys can say if you were going to give this a go. So obviously, the first concern here is patient safety and well-being, and it should always come first in any situation like this. So there's different stages to what you do. The most immediate action is to discreetly and calmly raise the concern with the student and like clarify the situation and actually see what's going on, because then you can assess the extent of it and then you can plan your next response. So let's say if the student who made the mistake decides to escalate it and report what happened and it gets documented, then that's fine because you know it's being dealt with. But if not, and if it's not adequately addressed, then you'd have to be the one to inform the clinical supervisor. And for professionalism, you just like the last person who gave this a go said, you want to be super non-judgmental. So avoid blaming anybody or being confrontational because again, you're all students, people do make mistakes. So you'd focus mainly on correcting the error and protecting the patient's safety and well-being. A few kind of ethical and soft skills that you can bring in are how dentistry requires honesty, accountability, and transparency. And obviously, ignoring a mistake would compromise patient trust and professional standards. So it could even be, for example, if this question was slightly different, it could be that this is a pattern in the student's behavior. So that would completely change the question and potentially make it even a fitness to practice issue. So this is very important. And always with situations like this, even though it is negative, you can always learn something from it. So in this one, um, you can kind of safety net to prevent these sort of issues happening in the future, and it just lets safe practice and lifelong professionalism keep going, if that makes sense. Does anyone have any questions about the last question we just did? If anyone does, feel free to just put them in the chat and we'll move on to the next one. So this is the next question. Tell us about a time when you had to adjust quickly to a new situation or unexpected challenge. How did you handle it and what did you learn? Very, very specific personal attributes question. But if anyone would like to give this a go, feel free to just unmute and start speaking. Do we not have any volunteers that want to give this a go?
Yeah, you can
Yes.
try,
Okay,
please.
perfect. Amazing.
Okay. So, um, one time where I had to adjust quickly to like a new situation or an unexpected challenge was when I had to deliver an assembly with like some of my other prefects, like the other prefect team, to like two whole year groups, and like we had already rehearsed and like planned who was going to say like the lines, and like it was like divided and we all had like a script. However, later on, just like approximately 10 minutes before the assembly started, we realized that one of the people wasn't going to come in because like of unexpected reasons, and we weren't sure because we weren't able to get into contact with them. And of course, that kind of was a bit alarming because all the lines had been distributed. So this is where we had to kind of had to show adaptability, and what we did was we quickly kind of had not like a proper rehearsal, but we divided the lines again, and we decided who was going to speak what, and I made sure that kind of like made sure that everybody kind of stayed calm and we could get through it, because otherwise it would lead to like a not very good assembly and leading to everybody getting stressed. So here I think it was important to stay calm, and luckily we were able to deliver a good assembly with like you know where it didn't sound like there was an unexpected issue just a few minutes ago. And it's very important to show adaptability in dentistry, because you often will have, patients from different backgrounds with different conditions and, different needs. So it's important to show adaptability, and also being able to react if something, for example, urgent comes up, and being able to prioritize and triage what tasks which should be done.
Amazing. Thank you very much for giving that a go. So you described the situation really well and you contextualized it very nicely. And you did also let me know how you handled it and you told me the outcome. Although one thing I would like you to elaborate a bit more on, say if you were to do this again, is the what would you learn part. Because these long questions, the easiest way to do it is split it up the way that they've gave you it. So it's tell us about a time, how did you handle it, what did you learn? And you can have three separate paragraphs for each one. So I think your what did you learn, best way to do that is to just say some sort of message and say how you're implementing it in your life at the moment, how you're going to implement it in maybe your studies in dental school in the future, and just show the interviewers that even though, there was mistakes in that situation, but you've learned something and you're changed for the better. Hamza, anything else to add?
Yeah, I agree. I think reflection is the most important part of the answer because it shows the interviewer how you have tackled that change and what you're doing proactively to get better at it. And I liked how you linked it to dentistry. A lot of applicants forget that bit. They'll just talk about what the challenge was and how they handled it, but they won't link it to dentistry and why it's important in dentistry, and you did that. So keep that up. Yeah.
Yeah, that was great. Perfect. Does anybody else want to give this question a go? This is our last question, so last chance if you wanted to get feedback on any answers.
I would like to, if that's okay.
Yes, of course.
So a time when I had to adjust quickly to a new situation was actually when I was tutoring. I came across a student very late into the GCSE period who wanted last minute revision on GCSE maths. And from doing a couple sessions with her, I understood that she wasn't really revising. She was quite behind on content. So for me, I found that a challenge because with the deadline of the GCSEs coming up, I wasn't really used to this type of student where I have to almost teach her the basics as well as exam questions. So the way I handled this was by adapting to her needs, understanding where, by doing things where getting an assessment of what the level she's currently at and trying to build a plan with her. How can we develop this in such a short time and try to give a certain routine? And when I'm teaching, how can I teach and tailor in a way that she can understand best in such a short time? And through doing that, we managed to successfully get a grade that she was happy with in such a short time, which honestly gave me a deep sense of satisfaction. And I learned a lot from this because I believe that in general, adaptability is very important in not only patient but student-based environments, because I saw that in my work experience where the dentists, when they were explaining treatment information to their patients, they weren't just spitting out or communicating to them. They were using methods like chunk and check, uh, breaking down complex information, much the same way I was doing it to the student, so that they can gain valid consent and make sure that the patient feels like they can trust in the institution. And I believe that's really important in general in the field of dentistry, where it's a field where you're dealing with patient anxiety. You're trying to do treatment plans with patients and ensure the best of patient health through preventative care and also restorative care. Thank you.
That was amazing. Thank you very much for giving that a go. So a few things I really, really liked and you should absolutely continue is your reflection was very nice and you linked your reflection to dentistry and you highlighted how sort of the message you learned is basically reinforced by what you saw in the clinic and like work experience. So that was really good because you're flexing that you've seen all of this and that's like what you're talking about. Um, yeah, I don't have any major feedback for that. It was very good. Hamza, do you have anything to add?
There's nothing to add, but I really enjoyed his structure, and I think the clarity of his answer was very clear. It was easy to follow, and I think, yeah, very good answer from Fahad.
Yeah, absolutely. I think another strength was definitely the signposting because sometimes when students are giving answers, they kind of go back and forth, and it makes it very hard as an interviewer to follow along and see what they're trying to say or what part of the question they're trying to answer. So you did it really well, which is amazing. But for anybody else here that kind of struggles with that a little bit, best thing to do is honestly just pick out parts of the question and then read out those parts as you're answering. So let's say you're doing the middle part of this. Just make sure you quote what it says. So I handled it by doing this. And then something that I learned was this, because then you're making it very obvious to the interviewer and in their head they can think, okay, they're moving on to this part, and then you won't end up losing any like content marks for missing out the question if you're like making it directly obvious what you're talking about. So I thought that was very good. Before we move on, does anybody want to give this last question a go? Nope. Okay, cool. So yeah, this is kind of a structure that I'd normally advise people to use when you're talking about personal attributes questions. So it's called STAR structure. I'm sure many of you have heard of it. It's situation, task, action, result, and reflection. So this is just an example of something that I saw in my work experience, not even a dentistry work experience. It was at a chiropractor. But so yeah, during you described the situation first. So during the placement, what was the problem? And then the task, say what was expected of you. Action, this is where you kind of want to flex how you did well on it. So in this one, you stayed calm and productive, asked clear questions, and you're just showing kind of what skills you learned, what skills you shown. And then the result is the ending, and nobody really misses out the result, which is good. But it's always the reflection that people miss out. And if you are the type of person that always misses out the reflection or thinks it's not detailed enough, genuinely just conclude with maybe like a message that you learned that you're gonna take into your dental school experience. That's the easiest way to make sure that you 100% get it in. Does that make sense to everyone? Cool, perfect. So we'll move on to the Q&A, and you can genuinely ask us absolutely anything. Obviously, due to NDAs, we will not be sharing specific interview questions, and I'll start with the ones that are in the chat. So, for that question before, should you mention the complaints procedure? So if the patient is dissatisfied and want to complain about it, yeah. And there's loads of different ways they can do it. So most like dentists or dental hospitals, they'll have maybe a designated complaints unit, or like if it's a dental hospital, it'll have a whistleblowing unit, and it just makes sure that all the complaints are dealt with systematically and the patient can be referred there. Do you need to document anyway, even if the fellow student did document it? So obviously, if the student has documented the issue, then no, you wouldn't need to document it because it's already been sorted and it's been dealt with. Does Plymouth have a personal statement station? I want to say no, they do not, although it's still very, very good practice. Make sure you print out your personal statement or anything, kind of highlight everything that's important, annotate it, and go through it the night before. Because in your interview, you're going to be talking about the same things on there anyway. So whether it has a personal statement station or not, it doesn't really matter. This recording is going to be on YouTube. Biggest tip for giving well-structured answers. Repeating things from the question and signposting. So let's say you're going to talk about three ideas. Just say, the three ideas I'm going to discuss are this, this, and this, and then be like, firstly, I'm going to talk about this, then next, and then finally, and then make sure you conclude it. And that will make it very easy to structure. Would you mention you're a biomed student in Plymouth in some questions? I mean, you absolutely could. So let's say it's a personal attributes question and they're saying when was a time you showed perseverance. You can talk about maybe a project you did. The entire Zoom recording is on YouTube. Do you not need to add the GDC principles in the answers? Hamza can talk a bit about how to add those principles in the answers.
Yeah, so regarding if you need to add GDC principles, it's not a requirement. You don't have to and have to do it. But if you do it, then it just shows that you understand what's going on. And I think it is important you do because it shows firstly that you understand what the problems are. For example, in an ethics one, you can say this violates the first GDC standard, which is to put patients' interests first. Or maybe you can use another one, which is to work well with your colleagues for the best safety of the patient. So I think using GDC standards to your advantage can work really well. But if you don't include it, it can be a weak answer. But I think really try to learn, not like the individual subsections, because that'll get too long. Just the main nine principles. And I think that will be sufficient for you to answer well enough in your answer.
Yeah, absolutely. It's always good to name drop them because let's say you're doing a question about, say, like a dentist using social media. If you just name drop one of the principles that you've memorized, then it shows that depth and that you've actually done a lot of research. Okay,
Yeah.
what to do if you don't have dental work experience? I did not have dental work experience. I did an online, like 1 hour dental work experience course thing. I wish I knew what it was.
Was it
It was
Discover
like
Dentistry?
I'm not too sure. It was by a university.
Sheffield. Must have been Sheffield.
It could have been, yeah,
Yeah, yeah.
definitely. How did you prepare as a fifth choice dent? What was similar and different? Okay, so for me, I actually really liked that dent was my fifth choice because with med, there was way too many things to learn. And for me, obviously, I preferred it because say if I bring in something from, like if I start talking about Gillick's competence and something like that, in a dent answer, it shows wider knowledge. Whereas if you say it in a med answer, it's like that's the usual, it's basic, everybody's meant to know that. So genuinely, I used it to my advantage. And med and dent answers are very, very similar, except I think in my Plymouth interview, I said GMC instead of GDC, and I corrected myself, and they genuinely weren't bothered. So like don't be afraid of tiny little slip-ups like that. It's not going to completely end your answer.
And
But
bear in mind, sorry,
yeah.
bear in mind, the uni won't know that you've applied for medicine because they only receive that specific application. So you can do the exact same as Angel and have just one dent interview. They won't know you've got four medical ones. So yeah.
Yeah, absolutely. And but in terms of prep, I started revising for the dentistry interview. So 2 days before, I read two articles each day on like BBC News about specific things I found interesting. And some of those were about amalgam versus composite fillings and water fluoridation, because there was actually at the time there was news articles in my area and a bit of like local discussion about water fluoridation. So that was quite interesting, and I brought that up in my interview. And something else that I also researched was this is very, very niche, but honestly, I would advise if you're only going to learn a few things, learn a few very nice niche things that also do link into loads of topics, because then no matter what they ask you, you'll still have a hot topic to bring up. So mine was how in South Asian countries, especially like India, um, like the toothpaste they sell don't actually have fluoride in it, and people aren't aware that your toothpaste should have fluoride in it. Whereas here, it's kind of standard that every single toothpaste will have it, and you can get max strength fluoride toothpaste, even like prescribed on the NHS. So I learned a lot about that too, and how it's due to misinformation, lack of education, that kind of thing. So health inequalities, and all of that is very related to med. So you've already got a strong backbone of that. Just kind of extend little bits of the things you find interesting into dentistry, and say if all else fails and you can only think of med things, talk about the biopsychosocial approach and how dental issues can impact your wider health, your mental health, and then say whatever med thing you were going to say. That's my advice, and that's how I dealt with it. Does Plymouth do a role
Nice.
play station? Not that I'm aware of. Could I talk about medicine work experience? You can, but not gonna lie, I would purposefully be slightly vague and leave out the fact that it's medicine. You can still talk about your event and what happened and what skills you were showing. I just wouldn't place so much emphasis on the fact that, like, say you were in a gastrointestinal ward or something. Okay, how did you both feel after your interviews? Confident you would get the offer or more nervous? Okay, so for me, I was not confident at all. I thought I was going to get rejected, but at that time I already had my KCL Med offer. And at that time, KCL Med was like my first choice. So I was happy. I wasn't too bothered. But the manual dexterity station, I completely messed up. The thing we were supposed to do, I didn't even do it properly. And I saw the interviewer like laughing at my final result. And I mean, what I did, I just remained smiley and calm and confident throughout, and it worked out fine. You just got to be delusional and pretend it works. Hamza, how did you find yours?
Yeah, that's pretty similar to you. I think once you finish an interview, your emotions are everywhere. So like you kind of um over kind of estimate how well you've done or how bad you've done. And I thought I failed it, I'll be honest. I thought I did bad, but come around offered it. I've got an offer. So I think don't be too harsh on yourself on the day if you feel like it has gone bad, because you never know. It can just be your brain playing tricks on you, like it did with me. And for a good 2 months, I was just worried about what I'm gonna get. But you know what? It's the God's plan. Yeah.
Yeah, absolutely. Honestly, after I think during the manual dexterity station, I said something so problematic that I thought I was gonna get like red flagged, and I said GMC about 4 times. So I thought I was like this offer would never come, but it came anyway. No matter how many mistakes you make, genuinely, please just stay very confident, stay smiley, trust in your preparation, and hope for the best. That's literally all you can do in this situation. Okay, how would you recommend structuring prep if it's your fifth choice as a med applicant so you don't know anything about dent? I kind of just talked about that, but in like structure wise, I read some articles 3 days before my interview. And then 2 days before my interview, I got sent the manual dexterity station. And I opened it and I thought, wow, this is so easy. So I left it for the night before. And then I couldn't like figure out what it was asking me to do or how to do it. So I didn't actually get a lot of time to like revise articles that much. I spent ages. Basically go on like actual reputable resources. So things like BBC News, like that World Health thing. Um, British Dental Journal, and find interesting articles. And what I did is while I was doing the manual dexterity practice, is I got my laptop to kind of autoplay it out loud because I was really short on time. So I was sort of multitasking and I was absorbing all of the information in my head while trying to, make it muscle memory so I know how to do the task. So that's the best advice I've got here. What's the icebreaker station like? We can't reveal anything too specific about like specific stations or questions, so I'm going to miss that one out. And no, we're not allowed to say what the stations are. Can you talk about medicine and allied health work experience? I have dental, but can you speak about those as well? Absolutely. So, my work experience, I did work experience at like a gym personal trainer. I did that. I also did like a paramedic work experience insight day. And I still talked about those in my medicine and dentistry interviews because if their question is tell me about a time you made a mistake and how did you fix this, then they're not saying, oh, it has to be dentistry related. As long as you give a good example and you're able to reflect on it, and then maybe you can link those skills to dentistry at the end, it's completely fine. Are they going to ask questions about the hot topics? I mean, I'm not the Plymouth interviewer, so I can't yes or no that one. But I can say that likely you will have to know about dentistry hot topics for a dentistry interview, so it is a good one to know. Now that it's getting closer to interviews, do you think it's better to focus on having perfect quality answers versus being prepared for the most questions? Definitely prepared for most questions, because imagine if you're doing those like perfect quality answers for like let's say hypothetically like five, so you have an amazing why dentistry, an amazing why Plymouth, but then when they start asking you about SJT you have absolutely nothing to say. That makes it really really suspicious and really obvious that you've just memorized things. What they want to see is that you're able to actually see their question, think about it, and come up with an answer based on your experiences, not like memorize model answers. Hamza, what do you think about that one?
Yeah, I think I agree with you. I think it's better to prepare for more than be perfect for few, because like you said, if it comes across as though you're being a robot and just learning a couple of answers, then it doesn't look good. But my advice would be to have one core experience. It could be a work experience, which is adaptable to a lot of different questions. So, for example, if you have a work experience, you can adapt it to a communication example, a teamwork example, a sympathy example. You can link it to pretty much anything. And I think because in an MMI you move around, so you've not got the same interviewer for the same station. So if you can use the same example again, then you can do it. There's not a problem, and that's what I did. So yeah, I think it's better to prepare rather than get a perfect answer.
Yeah, absolutely. Plus, if you prepare with more questions, then in your head, you're training your brain to be able to connect different ideas together. So no matter what weird question they give at you in the interview, because your brain's already prepared to link ideas together, you'll be able to do that on the spot. And that is much better preparation than memorizing something, because if they word the question differently, you're going to be kind of stuck. Um, if I'm a med applicant, it's 2 weeks enough to learn the hot topics. Honestly, I learned about 3 or 4 hot topics and I just read articles about them and I rinsed them in every single hot topic related station. So I think for some reason, I started talking about like amalgam versus composite fillings in about 3 different stations, even when it wasn't needed, because I was just convinced that I needed to show that knowledge. So, genuinely, with interviews, any interviews, it doesn't matter like how many, if you know 10 hot topics or 20, it's how you bring them into your answer and how you link them and what conclusions you make from them. So, say with the amalgam versus composite ones, I was talking about things like cost benefit analysis, obviously patient safety, aesthetics, mental health. It links to so many things. So, no matter what you're talking about, you just need a few good, strong hot topics to be able to bring into anything. How does the manual dexterity work? Do they have you prep it beforehand or is it live? So, they're obviously going to watch you do it. Um, if they want you to have something before the interview, they will tell you so that if you need something to do the task during the interview, they will tell you before the interview so you can have it prepared. And they'll make you kind of tilt your camera like a bit downwards, obviously, because you're using your hands, and so that they can see your workstation and what you're doing. But for Plymouth, they watch you do it. I know that for Bristol, I'm pretty sure it's like pre-prepared and then you just talk about it. Do they give out interviews online or in person? Interviews are online. Around when did you get your offers? Hamza, do you remember?
I got mine on the first couple of days of April. I want to say April. Yeah, I want to say April
Yeah,
time.
I think similar because I did my interview. I think mine might have been later actually. I did my interview quite late, which
Oh,
was about, I did it like end of March or like mid or end of
ah,
March. So actually, to be fair, yeah, I probably got it near end of April.
yeah.
What might trigger red flags? That's so scary. It's
Eh,
auto rejection. Hamza, have you got any examples?
I can't say exactly what can trigger a red flag because I don't know myself, but for example, the bog standard one, if you say you're doing dentistry for the money, um, big red flag. Or if you say something in an ethics scenario which just isn't professional, it's a red flag. But I think it's really hard to hit a red flag um if you do prepare. So if you're prepared, then I don't see why you'll hit it. You won't hit it, trust me. Just prepare for it. Um and yeah, there's nothing I can
Yeah.
really say regarding exact, but I'll give you a couple of examples.
I feel like you guys are good enough to use critical thinking because say if
Yeah.
they give you an SJT where it's like, you saw a fellow med student stealing syringes of anesthetic from the cupboard, you're not gonna say, like, oh, I'm gonna ask him to 50-50 them so we can sell them on like Depop. I know nobody's gonna say that. If you said that, yeah, you'd get red flagged. But you all do have a kind of vague idea of what is morally and legally correct. So unless you say something genuinely illegal and diabolical that they think you're going to be like the next Harold Shipman or something, I promise you, you will not get red flagged. Do you remember that icebreaker question that you got? Slightly,
NDAs.
but I can't say it. Yeah. I personally, I think the icebreaker question, like station concept, is so weird because icebreaker's supposed to chill you out, but it's a question that gets marked. How would you go around answering questions relating to your work experience if you have no in-person dentistry work experience? It doesn't have to be in person. Hamza, was yours in person?
Work experience.
Yeah.
Yeah, yeah.
Okay, fair enough. Mine wasn't, but you can still talk about anything that you've seen. So I always used to accompany my younger sister and my younger brother for their like dental appointments. So even if I've like spoke to the dentist because I was interested in something and maybe like when they were educating my siblings about something, then that technically does count of a bit of experience there. And even if you do only have online work experience like I did, it doesn't matter. It's been so difficult to get in-person work experience recently. So med schools and dent schools won't discriminate against you for not having in-person work experience. I just maybe if you want, you can leave out the fact that it's online. You don't need to specify because work experience is work experience. It doesn't matter where it was, what you were doing, as long as you've got valid conclusions to make based on it. Because some of mine, like I did work experience at a personal training gym, I still managed to bring that up in my interviews, even though I didn't apply for personal training at uni. So genuinely, it doesn't matter what the situation was. What's something you can say to stand out if they ask, do you have any questions for us? Hamza, have you got any ideas?
What's something you can say to stand out if they ask, do you have questions for us? I think literally anything, because if you ask something about the course, then it shows that you're well read. Or honestly, there's nothing you can say exactly, but if you do ask them something, don't make it somewhat like stupid. But yeah, make it a bit intriguing. Just think of something. I think um yeah, if you finish early, then you'll get asked that question, but nine out of 10 times you won't get asked that.
Yeah, and we're not going to give you guys like one solid question to ask because then, like, what, all 30 of you on this meeting are going to ask the exact same question and it's going to look so diabolical. But if you want to come up with one, then the recording's getting posted on YouTube. Just go like to the start where Hamza was describing like the course structure and things like that, and see what part of that you find interesting, and maybe ask like how many people are going to be in the group of people working on phantom meds, like genuinely anything like that. Just, yeah, whatever interests you. What hot topics to cover just generally like for dentistry?
There are
Interesting
so
random.
many. There are so
Yeah,
many.
it's not really something
Um,
you can list.
shall I list some?
Yeah,
You've got water fluoridation, you've got AI in dentistry, you've got what's another one?
amalgam versus composite,
Amalgam
payment
versus
bands.
composite, mini-Marta convention. You've got CRISPR gene therapy. There's so many, especially recently with advancements in technology, CAD/CAM scanners.
Oh, and
But
turkey
yeah,
teeth. That's not the
yeah, so
professional term. What's the professional term?
it's called dental tourism.
Yes.
There's so many. Um, but I think if you cover a few of them, then you should be good to go.
Yeah, exactly. Just pick nice ones that link into everything. So even mental health is a big one because anything to do with, say, your teeth. Let's say pain can impact your mental health. Even seeing the appearance of your teeth could impact your mental health. That
hmm
links to everything.
I think if you can study one or two hot topics and understand the kind of um, information it requires, then you can pick that information out and apply it somewhere else. And that's where reading about, like Angel did, on articles can help stimulate your mind, even when you're just reading something, to make them links.
Yeah, absolutely. How long is each station? Each station is, they should say it in the, I'm pretty sure they say it in the email.
Yeah, they should do.
Yeah, I don't have an exact number, but it would be something around like 6-ish minutes. What is the Plymouth offer holder day like? I didn't attend that. Hamza, did you?
Yeah, I did. It's a very nice experience. I think you get to meet a lot of the other offer holders and especially a lot of my friends now. I met them back in April, which was nice. They show you around the dental school, they'll give you a tour of the accommodation buildings they have, and it'll give you a city tour as well, and also a tour of the brand new dental school. Well, not dental school, sorry, the dental training compound where you'll see patients. Yeah, it's nice.
That's so cute. Okay, what do you mean by icebreaker question? That's just a station, and based on the
Just to
name, you
ease
can
you
kind
in.
of guess. Yeah, you can kind of guess what they're gonna say. Were the interviews intimidating or nice? I thought some of them were nice, but for me personally, I thought some of them were overly nice to the point where it started freaking me out and I thought it was fake. And then some of them were really intimidating because in my manual dexterity station, I made a very strange comment and he just stared at me and yeah, it got really awkward, but I didn't. I thought UCL Meds interviewers were the best, but Plymouth Dents, see, they weren't that bad. I thought Bristol Meds interviewers were like the least nicest. But yeah, so Plymouth Dent wasn't the worst. It was just one of my bad ones. What
I
about
think
you?
interviews they were actually all nice, but don't forget, like if you've got an interviewer and your time is 4 p.m., they've probably seen at least 50 students before you, so they can be tired and they might not respond as well as you'd hope they do, but they're all lovely.
Okay, is Hamza's setup good for online interview or do we need to show our arms also? Okay, that is completely fine for like a station where you're
Yeah,
talking, really.
if you can see
Um,
my hands while I'm talking, then that's fine.
Yeah, ideally what I do because see, you can see his shoulders and he's not moving his arms, he's not like looking at his phone under the table. So that is completely fine. But for the manual dexterity station, they will make you kind of tilt this like a bit lower so that they
Yeah.
can see what you're doing, basically. For someone with language barriers, what do you think is the best way to prepare for a dental interview?
Oh,
Um, I would just give a bigger emphasis on kind of talking and actually practically giving the questions a go. So some things I do are maybe put a timer in front of you and practice talking in front of the timer so you can practice pacing yourself as well. And something I did is I personally used to get like super anxious when talking in interviews especially. So I started practicing kind of in front of the mirror and seeing like my facial expressions, did they look weird, anything like that. And I also found it really off-putting if I filmed myself while doing practice interview questions. And genuinely, that was very scary because I'm just staring at myself on a massive screen. So, and obviously that's quite useful too because you can go through it and sort of mark your answers yourself or even give the same question a go and you can compare it because you have like your old recording and your new recording. So if you're focusing more on the speaking aspect, I definitely do those three things to make sure your communication's effective. If you're doing the interview in your room, do you blur the background or no? Genuinely, it doesn't matter. If you've got
Doesn't
so
matter.
many distracting things in the background, maybe you might want to, but it's not compulsory and it's not like you can't. So, yeah, genuinely, whatever you want, personal preference. If people are using Dent as fifth option and don't end up going to the uni, will that space be reallocated? Okay, so what they do is they give out obviously more offers than spaces because they on the website they literally advertise that like med people fifth option do the Dent. So they know that everybody's putting Plymouth Dent as their fifth choice. So these spaces, they give out more offers, like significantly more offers than the spaces essentially. So technically, yeah, it will get allocated because the med person just won't like firm it. Do we need to know any ethical cases like we do in medicine? Hamza, can you think of any?
No, there's nothing you need to know in dentistry, no.
Did you visit Plymouth before your interview? I have never been to Plymouth in my life.
No, I neither did I. Seeing as I live 6 hours away and didn't even know about Plymouth until I applied. So yeah, it was the first for me when
Fair
I
enough.
came.
I was the same with my unis that I'm at now. So I never went to any open days. I just applied to like random ones on UCAS. Like I saw the strategic application guide that OJAS made and I was like, okay, let's put the ones that like my UCAT score. Um, but yeah, I never visited any of my uni. So if you're kind of afraid of sort of not seeing the uni before, honestly, like just speak to a med student that's there or a dent student that's there and ask them about it. And that's all I did. And I solely based my decision on speaking to different people and what they said. So even if you can't visit, don't be scared because my first time seeing Imperial, which is where I'm at now, was genuinely about 2 weeks before like uni started, which was my move-in kind of thing. So yeah, don't be intimidated by that. Did you do any revision the night before your interview? All of my revision was the night before my interview because I left the task till this is not making me look prepared, but I left the task till like the day before and I couldn't figure out how to do it. And I was up till about 4 a.m. realizing I was cooked if I don't figure this out. So I figured out how to do the task. I read all my articles and I called it a day. I just crammed it because, see, if you're a med applicant with one dentistry interview, you don't actually need to learn it on a long term. So it was applicable to me because I could just learn it the night before and then forget it after my interview. If you're doing multiple dentistry interviews, obviously don't try and cram everything overnight because it just won't work and it will not be effective.
Um, what I did the night before my interview was literally just chill out. The last thing your brain needs is a lot of overwhelming stimulus. So what I did was just chill, chill with the family. I didn't even touch my interview PDF that I made. And this reminds me, make sure you get your sleep because sleep is very, very important when it comes to interviews. It actually makes a big difference regarding your recall. So yeah, make sure you get a lot of sleep.
Yeah, absolutely. With the sleep thing as well, even when I do mock interviews with people, if I'm like sat opposite somebody and they're kind of sat there yawning, rubbing their eyes are red, and they're just leaning back into their chair, it makes me feel like they don't want to be there and someone's forced them to come. So obviously, even if you're talking about like why dentistry, and you could genuinely be the most enthusiastic applicant, but if you're sat there yawning, the interviewer is not going to think you're a serious applicant. So sleep is very, very important. Do the interviewers prompt you and ask follow-ups if you're getting off track? Generally, yes. So some examples where they might do that are, let's say, obviously if they have a planned follow-up question. Another one might be if you completely ignore their question and start talking about something else, then yeah, they will prompt you to talk back about the actual question so you don't miss content marks. Were you offered 10K to defer? I heard it on the student room. Hamza, were you?
No comment. No comment.
Okay. Um, did you mention that you, oh yeah, Hamza, this one's for you as well. Did you
Okay.
mention that you live far away as maybe a potential con?
Um, I think I didn't really say anything about moving that far away, but if you do want to mention it, um, you can say that it could be a con as you have to move far away, or it could be a positive about like gaining that independence. So I think yeah, it depends on you really. But I didn't really say anything like that, no.
Yeah, absolutely. I mean, kind of similar, but I live, like, my family live quite kind of north, so like where Liverpool is, and I'm obviously in London, which is a bit far away. But you just kind of get used to it. You get independent, you figure stuff out, you meet people, and it's not as bad as it seems. What made you pick dentistry over medicine? Ooh, Hamza.
That's not me. Okay. Do you mean if I didn't choose medicine at all, but if you mean like why dentistry over medicine, I think number one is that you get to actually treat the patient there and then, instead of referring it onto a hospital or giving them some medicine, you actually get to see that transformative effect you have done on that patient. And that's one of the things that actually stood out to me in dentistry. Um, yeah, I think dentistry for me is you get to see much more of that transformative journey, from the beginning to the end. For example, if medicine, you might get a patient with pain in the leg. If you refer them onto the hospital, then that's it for you. But that's my personal opinion. That's why I chose dentistry.
Are the ethical scenarios in Dent very different to the sort you're exposed to in Med? I would say generally no, because the ethical pillars are the same. And say, like, just a random example, let's think about like the Charlie Gard case. That was like parental autonomy versus the healthcare professional's best interest. You can have that exact same thing in dentistry too, because the parents might think they need to exercise their own autonomy about what they think their child wants. Obviously, they might think it could be in their child's best interest not to get a treatment. The healthcare professionals could be saying they need the treatment. So generally, it's the ethical scenarios are very similar. Wait, is the girl a med or a dent student? I am an imperial medic, but I got my dentistry interview from Plymouth, and I do mock Plymouth interviews for MyUCAT, which is where me and Hamza are from. Um, is that all of our questions sorted? Seems like it. Is
Is
GDC
GDC?
value similar to GMC?
So I've read the Good Medical Practice. Isn't that like a document for SJT?
Yeah.
Yeah, so regarding professionalism, so SJT is really good. The the good medical practice is good for SJT and professionalism. And pretty much the values are very similar, except one's medicine and one's dentistry.
Yeah, generally it's the same principles, just different scenarios. If you like XYZ about dentistry, why not other allied healthcare? Because they also have XYZ. So unique things about dentistry that I really like are the fact that you're blending kind of a lot of practical work too. So you could even say dentistry is like an art. I think it's quite artistic. And there's not really that aspect in any other medical sort of profession. Hamza, have you got anything else?
Um, I think if they say why not this other healthcare, then honestly, it is your personal opinion. And like I
Yeah.
said before, it's that transformative effect that you can see of a patient. It's that continuity of care you get to experience. What Angel said about the artistic element in dentistry and how you get to see kind of the results almost straight away. But yeah,
Should I mention Charlie God or is it more of a Med thing? Genuinely, I don't see why Charlie God would ever need to be mentioned because the case is about withdrawing life support. The actual principles of it could come up in like a situational judgment style question, like maybe the parents have a different opinion to the dentist. Something like that could come up, but you'd never really need to mention Charlie God. It's not relevant here. For the Imperial Medic, are you happy with your decision or do you wish you could switch to Plymouth then? Okay, so for me personally, Plymouth is kind of far away. So in my head, I never actually like properly fully considered Plymouth, but I do kind of like dentistry. And sometimes I do have days where I'm like, okay, I should have just picked dentistry because I'm not gonna lie, it looks a lot more fun. But overall, I am happy with my decision because obviously I picked med because I like med and I like studying it. So yeah, it's kind of just personal decision, but yeah, I like it. Is it fine if I mention hospital work experience but relate back what I learned from it and saw to being a dentist? Absolutely, yes. What about the question about there's a patient who has a history of being aggressive and you are in an appointment already? What could that mean? So let's say if you're dealing with a patient in appointment and there's a patient outside who has a history of being aggressive. I'm assuming that in the dental clinic there would be other members of staff there to help deal with him. Because if you're currently undergoing like doing treatment for a patient, you can't just leave that patient midway. It's the patient safety risk. So okay, understaffed. There will still be. I highly, highly doubt they're going to give you a scenario where you are one solo dentist running an entire dental clinic and like simultaneously being the dentist, the dental therapist, the receptionist, that kind of thing.
Yeah, I agree.
Is it the wrong mindset to go into the interview thinking they do just want to get to know you? Yes, absolutely. So quite a lot of these with these personal questions, they don't want to hear you tell them a regurgitated answer about like respect. They want to hear you hear like the question and then think about your thing on the spot and then be able to link different ideas together. Obviously, in your prep, when you're doing loads of questions, you'll become quicker at linking ideas together. So ideally you want that, not like pre-memorized answers.
Just to mention, it came in my head. When you join a station, be smiley, introduce yourself, ask them how their day's going. Because sometimes it's just nice to say that and it shows that you're polite and you're well mannered. And sometimes it could be the difference between getting an offer and not. So yeah, just go out of your way, greet them, being friendly, and yeah.
Yeah, absolutely. For a tell us about yourself question, what things would you mention? Me personally, I just say random things like I like what do you like doing? Maybe like you like sports, going to the gym, that kind of thing. Something you're interested in, like do you like reading? Um, what keeps you like nice and calm? So maybe you like going on walks, you might like baking. Genuinely, it's just anything about yourself. But obviously, given that this is a dentistry interview, obviously turn some of those interesting hobbies slightly dentistry related. So a really, really good one to flex is anything manual dexterity related. So let's say you like I don't know. I
Painting.
heard somebody, yeah, painting is a very good one. I was thinking of like candle carving because somebody said that to me in an MMI once. So that's a very niche one, but you can say that. The one I was actually thinking of is let's say quite a lot of brown people. You probably might have done henna before or like around henna stands. That is a very, very good example because it's very artistic and you need to be really precise with your designs. So anything like that, you can even drop in as like tell us about yourself because you're kind of flexing dentistry related skills in there. Any tips for forming answers on the spot for unexpected questions? Ideally, you should have practiced so much that you'll always have some sort of thing to say. Also, Hamza, we do need to wrap up soon because there's a Liverpool Med event on
Oh,
this Zoom right after us.
that's fine. Just very quickly answering that last one. It's okay to ask for a moment to think about your answer. Don't just rush into it and give a poor answer. Ask them for a bit of time, and then you can carry on your answer.
Absolutely. Um, well, if that's all, thank you all for coming. Okay, the complete Zoom recording will be on YouTube. Thank you all for coming. It was really nice to have you guys like participate, message in the chat, and give these a go. Best of luck with all your interviews.
Thank you guys for coming, and wish you the best for your interviews.